So let's talk about physical institutional resources for a second. If it's all right, I wouldn't mind kind of finishing the talk, make sure I have some time for questions. I'm going to give you lots of data right now, some percentages, because if not, they take away my psychologist license. So what did families in BC, what did they say about the resources that they're accessing? Okay, in 2014 when we did the survey. So in terms of those preschoolers, right, I've already talked about the samples. These were we asked them, what are you currently receiving or have recently received in the last 6 months? Okay, not like currently like this last week. So in the last 6 months and current, what have you received? And the most frequent, most of these preschooler parents reported receiving some non-IBI early intervention, over about 80%, or intensive behavioral intervention at over 60%, followed by daycare. Some behavior management for behavior problems was about 40%, and then other things as we saw decreasing from there. Okay. What about for school-age youth? There's a different pattern of what parents of school-age youth were reporting they recently used, and a different percentage. Right? The most commonly endorsed one was an activity-based kind of a support, like something like, I guess, a music program or an art-based program at over 50%. A recreation program or an adapted recreation program was about 45%, and then behavior management again, and then social skills and respite at 30%, and we see a decreasing. So here you can see kind of the top frequently, currently used or recently used resources in BC, according to these families. I think about things like this news article on local scouts with autism makes remarkable transformation, regardless of whether it's what it means to be remarkable. An example of a resource that's there for this school-age individual. Or this job program in the school that helps to foster something that's really, really important to this individual, this kind of cooking class that this individual gets to participate in. And what about parents who were reporting on adults in BC? The most commonly used one, which was not that common, was 30% reported some post-secondary supports, 30% reported some aspect of family respite, followed a bit less by an employment or an adult day program and life skills, and we see it down. But nothing as high in terms of a singular one as high as 80% or even 50% that we saw with the other age groups. Okay, but the most common ones were post-secondary, respite, employment and adult day programs, followed by life skills and mental health treatment, right? Rounded out the top 5. And in terms of the 21 self-advocates, what were they using, or what had they accessed at some point in the last 6 months? We don't know if it was frequent. We don't know what the quality was like for any of these. We just know, did you use it at least once in the last 6 months? So very kind of gross level. And you can see that the one that really stands out is mental health treatment, but still under about 40% access or reported accessing some about half of the sample. Okay, and everybody was less than that after there. But what do we mean by these kind of resources? I think about this Wall Street Journal article that talks about programs that are pairing young adults with ASD, for example in this one, training them to work within a hospital setting. Right? That's different than, say, the other ones. There's all of these different ones. There's not a one-size-fits-all, but this seems to really kind of fit with that idea of what kind of resources are out there to help me align better with my context. There are also a lot of barriers to service access that families endorse, that people endorse. Okay? So, for example, here in BC, some of the most common barriers, right, for the preschool age group was a wait list or a lack of resources at 70%, or not being able to afford services at 50%, or being too young. This is the preschool group, so being too young to access services were kind of very common ones, and some issues around the training they felt with professionals. This is from a caregiver's perspective. For school-age youth, we can see in the red the school-age youth, again, lack of resources or a wait list, a lack of training in professionals, as well as other barriers that they needed that weren't on our list here, and being too old also seem to be common barriers for school-age individuals. For adults, right, again, waiting lists or a lack of resources, a lack of trained professionals, negative experiences with professionals in the past, or being ineligible even if they have a diagnosis, as well as being too old, were all commonly endorsed by caregivers of adults. Okay? Now, we don't know when they accomplished these barriers. We just asked a more general statement of barriers. But it gives you a flavor of some of the things, certainly, that are still quite common within the BC context for the families. And in terms of the one that stands out from self-advocates who were talking is not being able to afford services and negative experiences with professionals in the path or difficulty with professionals, right, that also come out. But again, it's a small sample, but we need to understand. We can ask about barriers, and that has a role to play, okay? We asked families about the top 5 current priority needs that they have in the province, right, for their kids. And we asked self-advocates about themselves. What are your top 5? Because we've learned in other research that if we said, what do you need? A lot of times everything gets selected, right? And we end up getting a kind of 80% across the board. So it helps in terms of, if we needed to prioritize, if we didn't have the ability to give you everything, but if you had to pick your top 5, what would they be? Okay, and that's kind of what we forced everybody to do. So there are other needs other than the top 5. They might actually still be receiving service in these areas and still say this is one of their priority needs that's not mutually exclusive. So in terms of preschool age groups here, the top 5 needs included, like the top of the top 5 needs included early intervention, whether it's IBI or non, social skills training, activity-based involvement. These are think about the themes here and how that relates to what I was saying about ecological assets and internal skill development, right? It either maps on to something in their context or in terms of a skill building aspect. And I guess most programs do. But the point is that, say, priority needs for school-age youth, what is the most common top 5 priority need is social skills programs, right? Followed by, and remember what was one of the things that was related to thriving, right? Social communication ability, okay? Activity-based programs, participation in my community, right? Participation in my schools, recreation and leisure programs, specialized summer camps. These were all high priority areas for families of school-age youth. For top 5 needs for caregivers of adults with BC in adults about their adult age children, employment supports was the most frequently endorsed one. Again, social skills, life skills training, so that adaptive behavior, as well as some other ones like safe and effective housing, right, and recreation, leisure, and post-secondary education. Okay, so we're seeing there is a pattern here that's developing, and it's age-related. And in terms of the self-advocates, certainly even though the most frequently endorsed use was mental health treatment, that is one of their priority needs, as well as employment supports and post-secondary supports. Okay. We also ask professionals, just generally, and we can't divide based on age, like professionals who work in the field, who are in BC, what do you think the priority needs are for people with ASD in your province? And the top 5 were early detection of ASD. Now, that's not one of the top 5 for all the families, because only people who have already been diagnosed participated in the survey. But early IBI, social skills, early interventions, and behavior management were all common. So, these are kind of questions that we use when we're trying to figure out, okay, what kind of resources do we need to prioritize? But a slightly different angle is, how could we also make that fit within this thriving context? And I think there is some alignment with the thriving context.